Welcome to Supporting Staff During COVID-19, brought to you by the University of Pittsburgh School of Pharmacy, Program Evaluation, and Research Unit. Today's presentation is intended to assist organizational leaders in effectively supporting staff during this unprecedented time. Specifically, we will discuss potential experiences by staff, the impact of trauma, and what you as a leader can do for your staff. If you think back to the first time you heard about COVID-19 or coronavirus, you may feel that that day occurred years ago. For others, life has been such a blur that it may feel like it was just yesterday you heard about this virus spreading across the globe. For Pennsylvanians, our state escalated from the first case to a statewide stay-at-home order in just 28 days. In those 28 days, individuals and organizations went from life as usual to chaos, with little time to think about in between. Leadership teams across the organizations were thrust into crisis management. Who is an essential worker? Do we have enough masks? How do we continue to provide care to our patients? How do we pay our staff? Like never before, organizations had to completely restructure every aspect of their work. Just the thought is overwhelming. Eventually, crisis management transitioned to an adjustment and a new routine set in. Work from home became less challenging, new protocols were established, and for the first time, leaders were able to take a breath. Now what? We do not know when life will return to normal. So how can you, as a leader, effectively manage and support staff when the future remains undetermined? Our intention is that you will find in this presentation with that answer to that daunting question. If we were to boil it down, there are 5 keys to an effective approach moving forward. The first is simple. Lead, be present. How staff handle stress of the pandemic will largely depend on your actions. Show your staff that you are there, you are committed, and there is stability within your organization. A Gallup meta-analysis of worries and stressors following major crises over the past 80 years, such as the Great Depression, the Kennedy assassination, and 9/11, found these 4 traits to be universal needs followers have of their leaders. Staff will look to leadership for a signal that things are going to be okay. Even if you don't have the answers they're seeking, being honest and consistent sends a message of stability. Humans thrive on consistency. We like to be able to predict things. It provides a sense of control, especially when we're in situations where we have little to no control. Provide that consistency by ensuring that the communication about organization needs, changes, expectations are from the top down. We all know the telephone game. Someone starts with a message which is passed from one person to another, and when the last person gets the message has completely changed. Imagine a situation you've experienced in which you had to repair damage caused by miscommunication between staff. We all have been there. Remember how frustrating it was and how much of your time, which you probably didn't have, that took up? Now imagine adding in a pandemic. Top-down communication is essential for staff and leadership. For staff, it demonstrates that they will be kept informed, that they can know what to expect from leadership, and that they know what information that sounds odd from a colleague isn't valid. For leaders, this will save you time in the long run. You won't have to worry about who has and hasn't been updated by backtracking to correct misinformation. Be mindful of the impact of your communication. What may be obvious sarcasm to you may be perceived as something serious by an anxious employee. During the crisis management phase of the COVID-19 impact on your organization, you filtered out unnecessary tasks and projects. Continue to prioritize what needs to be done now and what new projects or tasks are realistic. It may be that a new need has arisen and roles and responsibilities need to shift to cover the need, such as someone being at the door to manage how many patients are in and out of the building at once. It's a natural response to stress for someone to have less availability to manage multiple tasks at once. Additionally, we are less capable to do and remember details that we learned during a stressful situation. For that reason, it is essential that leaders clarify, review, and restate the essential messages, expectations, or policy changes. Everyone is adjusting to this new normal. To assist in ensuring that staff are appropriately updated, consider having an identified time for updates. Perhaps your organization has a daily or weekly all-staff virtual meeting. Inform staff of all significant announcements will be made during that time, and it will be from leadership. Again, this will provide staff with a sense of predictability and consistency. After those messages, provide a written explanation and review what was announced to staff. Keep these written summaries, policy changes, or announcements in a central location that staff can easily access. Think of it as a virtual bulletin board. This may take the form of a specific web page or a shared folder. Regardless of the form, ensure that you remain consistent and keep all updates in that central location. Remember, the more information staff have and the greater sense of control, the better they will be able to cope with the stress and the situation and changes. Perhaps some of the most essential communication you will provide is tackling elephants in the room. There is going to be a lot going through everyone's minds, and they may be worried about asking questions. At a time when having a job is appreciated more than ever, staff may not ask questions out of the fear of drawing attention to their struggles and concerns. If a leader addresses these tougher topics, staff will feel more comfortable addressing their concerns and asking for support. It is also important that leaders inform staff of support services. Maintain updated contact information for your organization's EAP and FMLA providers. Leaders should validate the significance of the pandemic and normalize seeking support. Again, staff may be fearful of losing their job if they indicate that they are struggling. Ensure that staff understand that there isn't anything wrong with asking for help and encourage them to seek any services they may find beneficial. Each staff member is experiencing this pandemic in a unique way to them. What is stressful for one staff member may not be of concern to the next. Leaders who are aware of the variety of challenges staff may face are better prepared to anticipate staff needs and offer support. One of your staff members may be coping with their partner's job loss or the loss of a second job, causing them financial distress. Working from home may lead to staff having difficulty separating their work life from their personal life, responding to emails at all times of the day when they're technically off the clock. For staff who are caregivers for parents or elderly loved ones, or whose loved ones are in a living facility, may be overwhelmed with the worry about their loved one's health. Being a caregiver isn't something staff are likely to share at the workplace. A report from Harvard Business School found that employees worried about being a caregiver could negatively impact their career opportunities. You may be surprised to learn that one or more of your staff are the primary caregiver for an older relative. And of course, we can't forget the significant challenges parents are facing as education has transitioned to virtual platforms. On top of their work obligations, parents are now struggling to find childcare if they have to go into work and balancing their work from home with their children's virtual education. Peer data from the Pew Research Center in 2013, 47% of all middle-aged Americans are part of the sandwich generation, meaning that they are caring for parents over the age of 65 and children under 18. Imagine if you're a caregiver of someone in a high-risk group, such as those who are over the age of 65, who have respiratory issues, and are going into the workspace. The concern about potential COVID-19 transmission to your loved one could be understandably overwhelming. Just as leaders may not know what personal stressors staff are facing, they also may not realize what losses the staff member has endured. Sometimes the most lasting effect to a traumatic experience are the less recognized losses that a person endures. These losses are often overshadowed by the more acknowledged trauma. As staff leaders, be mindful that your staff member may be grieving and that they may not feel supported in their grief. Leaders can validate the experiences of staff and acknowledge that complete life upheaval caused by COVID-19 has many effects that they are not always as apparent to others. Even if a leader only addresses these losses in a larger group context, such as during a staff meeting, individual staff will take comfort in knowing that their leadership understands that it is a difficult time for everyone. If a leader is willing to share some of their own loss struggles, such as the loss of stopping at their favorite coffee shop in the morning, on their way to work, staff may feel more comfortable expressing any difficulties that they are experiencing. After all, it is a traumatic experience for everyone, and everyone has experienced some form of loss. As mentioned before, each staff member is going to have their own unique experience. We are all aware of the flight or fight responses to trauma, but many are not aware of freeze. Unfortunately, few are aware of the fourth trauma response, fawn. The fawn response trauma consists of a person becoming compliant and appeasing. For a staff member, this may present as a typically opinionated and self-directed employee becoming more focused on following the directions of others and appeasing those around them. Or this could be a quiet employee who seems to be even more conforming to the group of their best interest or opinion. You may find an employee who has a fawn response gravitating towards a peer who has a fight response, and the former employee following the lead and appeasing the latter. Reminding yourself of the various trauma responses can help you understand potential changes in staff and how to assist them. For example, an employee who has a fight response would likely be well suited for additional tasks, then likely cope through accomplishments by doing. For healthcare professionals, COVID-19 is an example of a time in which a professional and patient or client have shared a communal trauma. As a result of the shared trauma, healthcare professionals may have a greater difficulty separating their personal experience to a traumatic event, COVID-19, from the patient's experience. For example, if a staff member is struggling with balancing work and overseeing their child's virtual education, the patient expresses to them the significant difficulty they are experiencing with their child's being schooled at home. The staff member may have a natural reaction of feeling connected and wanting to express this mutual challenge. If the staff member is struggling to cope with their own anxiety, they may have a significant difficulty properly assisting a patient in coping with their anxiety. The possibility of countertransference is very strong when there is shared trauma. Countertransference is typically discussed in reference to counselor-patient dynamics, but is applicable to all healthcare professionals. Countertransference is the process described previously when a counselor over-identifies with a patient and the connection is brought into the professional interaction. With shared trauma, there is an increased likelihood of personal disclosure to patients in connection with the countertransference. The nurse may say, "I know exactly what you mean. I'm having such a hard time staying on top of all my kids' online schoolwork. I don't know how teachers do it. I need a glass of wine every night after all of that." It is essential that leadership be aware of the impact of the shared trauma, not to reprimand staff, but to be prepared to address the issue and offer support to staff. Encourage staff to seek supervision if they find themselves over-identifying with patients. When they seek supervision, respond with openness, understanding, and appreciation for their willingness to talk through their experience. Assist staff in identifying how they can respond differently in the future if they have a similar response, and encourage them to continue seeking supervision or support from EAP services if they continue to have difficulty. Look for opportunities to reduce stress in the workplace. If workplace stress is reduced, staff will be likely to be better to regulate their personal experiences and maintain professional boundaries. Is there someone in your organization who is responsible for doing something that nobody else knows how to do? Can you imagine how stressful it could be for that staff member to know that, should they get sick, something important cannot be done? Cross-training staff will not only help you should someone be unable to work for a couple of weeks, but would also relieve stress for that essential employee. Be sure, though, to explain that cross-training is occurring. Remember the significance of communication. Last thing you want is to have a staff member thinking that they will be replaced. If there's tasks or a task that is extremely demanding, rotate the task so that one person isn't inundated with stress. Ask for volunteers to assist others. Anticipate what may be overwhelming. Staff may not be able to share when they are overwhelmed for fear of being replaced. And finally, consider having a location in the office where there is no discussion about COVID-19. Sometimes, we all just need a break from the constant discussion of the stressor. Be aware of signs of distress and prepare to take action. What's your plan of action if you see a staff member who is struggling? What will you do in addition to offering EAP services? What flexibility can you offer to staff who are having difficulty? Have a plan ready, and hopefully you won't need to use it. We've all heard the saying that doctors make the worst patients. Well, healthcare professionals aren't very good at taking time to tend for their self-care and are experts at putting others first. Keep in mind that the staff member who appears to be excelling in a time of chaos may actually be the person who is having the greatest difficulty. Challenge these negative thoughts that staff may experience. Again, bring the elephants into the room. Yes, you are a healthcare professional. Yes, your job is to help others. No, your self-care should not suffer as a result. It can be easy for leaders to accept the surface presentation of staff. It would be a lot easier if no one needed help, but let's be honest, that is extremely unlikely to happen. This certainly doesn't mean that everyone who looks okay isn't, and it is important to consider if there are any signs that stoicism is a shield. We know the possibility of negative self-talk, such as, I feel guilty for taking time for myself. Imagine if, in addition to the self-talk, a person is experiencing a work environment focused on the negative. Encourage staff to use non-stigmatizing language, as you never know who can be relating to what is being said. Think of the staff member who you just learned is also a caregiver for their parent. Now, we know that the staff member is likely scared of transmitting COVID-19 to their parent. What happens if the parent tests positive for COVID-19? What happens if their parent tests positive and then the staff member hears a colleague saying without a reference to them? At this point, the only people who are getting sick are the ones stupid enough to not follow the guidelines. Your staff member followed the guidelines, and yet their parents still tested positive. That wouldn't exactly be the friendly work environment for a staff member. Whenever possible, in whatever possible way, encourage your staff to connect with each other. We're social beings. We need connection to people. For some, work is their only social connection. If your organization doesn't already have something in plan and place, consider asking for volunteers to lead a morale committee that can come up with ideas for team building, ongoing connection, and virtual activities. Now, you may be wondering what a virtual pet social is. It is an opportunity for staff to introduce their pets to everyone. Who doesn't love to see their cute pets and hearing funny stories about their antics? That socialization amongst staff will also contribute to a sense of being unified as a team, which is key to managing stressful situations. Avoid creating any separations within the organization. To be successful in such a trying time, everyone will need to take a part of the team. That message comes from top down. Speak as a we to emphasize that cohesive, united approach. What are your staff doing to care for themselves? Whether your employees are coming into the office or working from home, self-care is essential. As a leader, you can model this by sharing self-care tactics that you have been using. Additionally, you can randomly send a message or call a staff member and encourage them to take a 10-minute self-care break. Can you imagine the sense of support a staff member would feel if their supervisor prompts for self-care time? Encourage staff to connect to self-care activities, such as a guided meditation through virtual platforms. Not only is this self-care, but it is peer-to-peer connection. In addition to these organization-wide initiatives, leaders can also take a more direct action to support staff. Offer time, one-on-one, for staff to speak with you directly. They may be more comfortable addressing issues, concerns, and challenges with you rather than in a group setting. You can reach out to staff and provide them with specific feedback on what they have done well. Hey John, I just wanted to send you an email to let you know how impressed I was when you jumped into that meeting last week with your ideas to address the problem. You showed great initiative. When possible, provide flexible work opportunities to staff. Whether that's flexing start or end times, working from home, or alternative work schedules. Use an individualized approach with staff. Remember the different trauma responses, the fact that each person's experience is unique, and that each staff member is going to handle stress in their own way. Of course, there are some things that require more tactical response, such as when a staff member or someone a staff member lives with tests positive for COVID-19. Such a situation is a delicate balance between safety of the organization and staff, and the privacy of the individual staff member. Share with staff in advance, if possible, how such a situation will be handled. They may fear of how their privacy will be respected and how their peers will treat them should they or their in-home loved one test positive. Be sure to consult with your organization's HR for any policies regarding the situation. However it is decided to be handled, ensure that you are consistent from staff member to staff member on how the situation will be handled. Are you feeling overwhelmed? It's okay if you are. It would be completely understandable. The presentation started by putting you in the spotlight. Let's take time now to acknowledge everything you, as a leader, are doing and have had to accomplish. You are taking action and leading a team through a crisis never seen before. You deserve praise for your work. And here you are learning on how to support your staff. Leaders can be stoic too. It is of the utmost importance that you tend to your own self-care. Build your support system, utilize them, and listen to them when they express concern that you are taking on too much. Be a role model for your staff. Demonstrate for them what healthy work-life boundaries look like, how important self-care is, and how normal it is to struggle at times. Just like they tell you on the airplanes with oxygen masks, you have to take care of yourself before you take care of someone else. If you are looking for any resources on self-care, supporting staff, and COVID-19 related information, visit www.overdosefreepa.pitt.edu. We are regularly updating the website with information intended to help everyone navigate through this stressful time. For any questions or requests for additional information, please feel free to contact Whitney Minarchuk, Quality Improvement Specialist. Thank you.